I sometimes can tell if my patients are lying to me about how often they check their blood sugars if they're a type 2 diabetic in particular. How? When I see patients, especially with type 2 diabetes, I ask them, okay, what are your sugars running in the morning? Your fasting sugars. They'll give me some numbers. And what's important to me is knowing what those are and sort of understanding what's going on. If somebody tells me that their fasting sugars are around 105, 110, 112, which by the way is pretty decent for a type 2 diabetic, many of them that I treat, but I get your A1C, that's your 3-month average of your blood sugars on your lab sheet, and your A1C is 10%, I know there's a disconnect. If you have an A1C of 10%, chances are your blood sugars are much, much higher than that 105, 110, 112 that you told me about. Now, what could that mean? It could mean that you actually were not honest about how often you check your sugars. Maybe you're not checking them at all. It could also mean that you're just not checking them enough. Maybe a couple times you get low sugars, but maybe more than not, your sugars are too high and you just don't know it. There's also a potential issue where maybe the glucometer is actually, your blood sugar machine is just not reading correctly, and maybe you are checking your sugars adequately. So I have to be fair, and I like to be fair and honest about that. But how well fasting sugars correlates with A1C, or if they correlate, can sometimes be a tip-off if a patient is being maybe truthful or honest about what they're doing at home. Obviously, it's not always the case, but that is one thing. The next thing is, sometimes I can tell if patients are taking their medications or not. Not always, but sometimes. Okay, so let me give you some examples. Blood pressure is high despite repeated increases in blood pressure medications or adding on medications. If that starts to happen, I then have to start wondering, hey, is this patient actually taking the medications I'm giving them? I've had certainly enough situations where the patient really wasn't taking the medications, and I learned about this as you know, to know that this can happen. Another situation is sometimes with the thyroid medications in particular. If someone's thyroid becomes abnormal, sometimes it can mean that maybe someone's forgotten a few doses here or there, or accidentally doubled up or something. That is an indicator for me to call the patient and say, hey, did you miss any doses? Da, 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 da. And it's not about catching someone in a lie, but sometimes labs do paint a picture and give us an idea, or try to give us an idea about what's going on. The other way we can often tell if a patient's actually taking their medications appropriately or not is how often you call for refills. So I've had patients come to me saying that they're taking their this medicine or that medicine appropriately and all the time, but I look at the chart and see that I have not sent a refill to the pharmacy in a year and a half. Now, it doesn't mean that they're still not taking it, but I have to ask things like, okay, I haven't refilled it. Have you got it from somewhere else? Did you have meds left over? Are you taking them every day? Are you rationing them? Like, what actually is happening? Okay, so understand that that can be a sign that someone's not taking their medications or taking them appropriately, or again, is another doctor prescribing them. Number 3 is smoking, cigarettes or other substances. You know, sometimes patients won't tell me that they smoke, but the thing is, we can smell it, okay? This is not a criticism, it's just the truth. And actually, this is often a really good opportunity for conversation. But remember, in my experience with most people who smoke a substance, some substances, whatever, often don't realize how much they actually smell of that substance because they live around it, right? They live with it, they live around it, it's in their car, their home, or whatever, and it gets on your clothes, it gets on your coat. So when you come into my office, I can smell it. Now, I will often ask, okay, how much do you smoke? Do you smoke? What do you smoke? And you're right, it may not be the person that's my patient that smokes, but if it's not, it's someone that they've been around, okay? So once again, not condemning you if this is you, but just letting you know that these are clues and cues that doctors use to maybe tell if there's more to the story than we imagine. The last situation is with controlled medications. Last situation I want to bring up, controlled medications like pain medications, anxiety medications, or prescription controlled medications controlled by the DEA that are tightly controlled. We can, and that's a classes of medications that are tightly regulated. Over the years, I've had many experiences where patients try to say, oh, I'm not getting these medications from anywhere else, or no, I only got 20 pills, doc, you didn't give me the 30 you said. Well, understand, we can often tell if a patient is lying or being truthful about that because there is a registry. There are websites that we as physicians are actually part of, that we're registered as part of, and we can look you up online and see who gave you prescriptions, how many pills, what date, what time even. Are you getting them from multiple places? So Again, this is a video about education, okay? Again, it's not about condemnation. And remember that in many of these situations, it's not even about, say, a patient lying. It could just be that a patient's not doing everything, maybe doing some things, or maybe it's someone else in the household in the case of smoking, right? So just keep these things in mind. These are some ins and outs of how we doctors think and some clues and things that we use to help treat you to the best of our abilities. And there are other things too. These are just 4 big topics. I wanted to let you know about this and give me some feedback. Let me know what you think about these things. Did you know this? Did you not know this? I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. For those of you on Facebook, please like and follow my page. For those of you who send stars, I respond personally. Thank you so much. On YouTube, please subscribe to my channel. Click the little bell for updates. Thank you guys. Go to Dr. Jen Caudle for updates. I'll see you soon. Love y'all.